And I think the distinction that we're hearing is the general theme that estrogens can promote the growth of breast cancer, and the specific information that in the Women's Health Initiative, the combination was proven to be associated with a higher risk, right?
Yeah, it's clear that it was the combination. It was a drug called Prempro used. Exactly why it's worse with the progestins isn't clear, although it seems to promote the cell growth when you have the combination.
But I think the question that is being raised, and it's a very good one, is whether estrogens in and of themselves represent a risk, or whether this is a unique risk to the combination.
In this study, the women who had had hysterectomies, which was close to 30%, took only estrogen alone. And they did not have that increase that the combination showed.
And so are you going so far as to endorse just estrogen use? I want to make sure we're not misunderstanding you.
I don't personally endorse it as it's part of being normal as you grow older, which was used to be stated. But I think, menopausal symptoms can be severe, and you can talk with your physician about, a low dose for a short term, because you don't really want all of those symptoms.
Right. I think Larry has a thought he wants to
I think I do.
I got that, the body language, I got a hint.
Yeah, it's sort of like the spring here in my chair is making me jump up and down. It doesn't prove that estrogens alone are safe. And obviously the reason for the progestins is because if you take estrogen and you have a uterus, you're going to stimulate the uterus and you develop problems in the uterus, including uterine cancer. So progesterone shuts that off. All of these hormones have different effects on different organs. We call them selective estrogen receptor stimulators, modifiers. And that progestin, although it decreases proliferation or cell division in the uterus, can actually increase it in the breast. And so therefore the combination of the two is kind of a double whammy. In the laboratory, the combination is particularly stimulating, because one of the things that happens when an estrogen receptor positive tumor is stimulated by estrogen is the progesterone receptor level comes up, and it makes it more sensitive to progesterone stimulation. And so the two things really work hand in hand. And many of my colleagues here could talk about this from their own laboratory experience in this regard. In biology, when you have two factors like that, estrogen and progesterone, they make things more than twice as much apparent, if I can explain it. It's what's called they affect exponents of growth curves. Forgive me for, this is what I do for my science, is growth curves. And so you think of it as compound interest. If instead of making 5% on your money, you make 10% on your money, you don't make twice as much money, you make a dramatically more amount of money because it's a constant multiplicative effect. And so that's why we see it very, very readily. But it doesn't mean that the estrogen itself is safe by any stretch of the imagination. Because when you look at the cells in cell culture, you see the same kinds of effects, just at a lower degree. There's lots of reasons why you may not see it in a clinical trial. Duration of exposure may be a factor. And recently there's been, and this is a contentious issue that's actually being debated right now, actually, over the last couple of weeks. When you're dealing with a factor like hormones that could stimulate breast cancer, does this mean that it's okay to use a short duration? And the fact is we don't really know. And it might be like tipping the beans, and a fairly short duration might have most of the activity of a longer duration. If you're pregnant, it's a hormonal effect on the rest of your body for 9 months, but it affects your body for the rest of your life. And the effect is over. You heard about tamoxifen. Tamoxifen prevention trial, you're exposed to it for a certain number of years, and then you stop, and the benefits accrue for many years later. So that with hormones, often you can start things off, they can continue. It's possible a short period of estrogen could stimulate something, and you can't turn it off, and you can develop a problem later on. So the best bet, I think, very strongly, is to avoid it entirely. And one of the things that's, last comment on this, one of the things that's in the press a lot is, oh my God, what are all these poor women going to do? They have postmenopausal symptoms, and how are they going to get relief? We have lots of things. First of all, most people in the postmenopausal years feel fine. But when you have an individual problem, it can be attended to. Osteoporosis, we've got really good therapies for that, to prevent that, so on. Hot flashes, we have ways of dealing with that work in most people. vaginal dryness. We've got various preparations that seem safe and still being investigated, but seem safe that work. So that there are other approaches that we can use to deal with the issue. It isn't like, sorry, there's nothing left to be done. And so I would say that until we've proven that short exposures are safe, until we've proven that estrogen without progesterone is safe, if you had a uterus, really nailed that down, the best thing to do is to be as natural as possible. And, we evolved, or God created us, or God created us by evolution. I've covered all the bases. In a certain way, and adherence to all those hundreds of thousands or millions of years of wisdom of biology is something that we shouldn't turn our backs on.
So you've thought about this? Yeah.